Hello and welcome to the 2017 edition of the RSNA meeting in Chicago. My name is Brian Casey. I'm editor-in-chief of AntMini.com. One of the big issues in healthcare in general and in radiology in particular has been the issue of quality and value. Are we really getting the quality that we're looking for when we do imaging procedures and other types of medical procedures? We're fortunate enough to have with us today Dr. Pamela Johnson of Johns Hopkins University and Dr. Yoshimi Anzai of the University of Utah. They're going to be talking about the issue of quality in radiology. Now, it seems like whenever there's a discussion over value in healthcare, it seems like radiology is always finding itself in the spotlight. Why do you think that is?
Yes, well, radiology exams are in the spotlight in the transition to high-value care, and there are a number of reasons. One is that they contribute to costs. They're expensive for patients. They carry risks, radiation, and so we want to be very particular about making sure that every imaging exam we do adds value to patient care without adding unnecessary costs. Now, imaging exams are very important. They expedite care. They help doctors determine the best management for patients, and that's really where we bring value to patient care. But at the same time, we have a responsibility to ensure that when providers are ordering imaging tests, that they're selecting the best exam for that patient in that setting.
Now, there have been some initiatives like the Choosing Wisely initiative that try to make physicians aware of certain types of procedures that maybe aren't really adding a lot of value to patient care. It always seems like there's a lot of imaging studies on these lists. Why do you think that is?
Well, I think the imaging test that we have been doing more and more study we do, somehow we were reimbursed that's the fee-for-service model. But we're going to have to shift it from more tests we do to really doing a right test for the patient. And the radiologist, we are the imaging specialists, so we have a best knowledge of what imaging test should benefit patient. So we should taking that leading position for choosing what imaging test is the best. And I think that's what we're going to have to make a more effort on that aspect.
Okay. Now, you have both been involved in an initiative to try to promote more quality in radiology and imaging. Can you talk a little bit about that?
Yes, well, Yoshimi and I have been working together. We created something called the High Value Practice Academic Alliance, which is now a consortium of 90 academic centers across the country. It's a multi-specialty organization with more than 27 specialties and subspecialties represented. But there's a big radiology contingent. We have about 25 radiology departments working together. And we have a number of quality improvement projects that we're going to be doing together to improve value, creating standardized recommendations for incidental findings where all the radiologists make the exact same recommendation to try and reduce unnecessary downstream tests that come from imaging, and a number of other projects. And it's really been very exciting. We think it's important that radiologists lead, not just in improving value in radiology, but in improving value across the country within our medical institutions. Yeah. We can be the champions.
Do you have some specific examples of things that have been done either at Johns Hopkins or at the University of Utah where areas that you guys have chosen to attack and improve quality?
Right. Many of the things that we've been doing are something that in the list of Choosing Wisely, like imaging for low back pain, imaging for headache, preoperative chest X-ray for people who don't have any medical conditions, stuff like that. It's very low-hanging fruits for me that we know that we don't add too much value. So these are the kind of things that we've been doing. But I think moving forward, more guideline-specific imaging appropriateness would be really something that we should tackle on.
Okay. And these are some things like the ACR, appropriate criteria, things like that. Now, do you see much potential in the use of IT systems, maybe physician ordering, things like that can maybe guide referring physicians to ordering proper tests rather than sort of flying by the seat of their pants?
Absolutely. I think that IT really played a huge role in guiding a right appropriate testing. I think a physician has a lot of pressure to do EMR and looking at so many things, but if the EHR extract the information rather than they have to look for and type for it, And then I think that will help the clinician to guide a better test. For example, pulmonary emboli.
Yeah.
There's so many kind of medical variable that's already in the EMR.
Yeah.
So that should be extracted to the EMR so that the physician know where the risks are, and you can guide the right test for the patients.
Yeah. No, a lot of radiologists might be saying, well, I don't order the tests.
Right.
You're like, well, I just do what I just do the tests that the referring physician tells me to do. So what sort of advice would you have for them, and how to deal with requests that come in from referring physicians for tests that maybe MR for low back pain or something like that?
Well, see, I think that's exactly the attitude that we have to change, because we really are responsible we're responsible for imaging the patient from the moment the exam is ordered, and we have to be involved, and we have to be consultants to the referring doctors. We have a consulting service at Hopkins where they can call a senior resident when they have any question about what exam to order. So we have to make ourselves available. IT and clinical decision support, absolutely necessary. Education is necessary, and being available as consultants is equally important. And so I think that's one thing that radiologists can do across the country, whether they're in academic or community or private practice, just being available to the referring doctors. We also have a responsibility in terms of selecting the best protocol for the patient, because there are different costs and radiation exposures depending on the protocol that you select. And one of the new ACR Choosing Wisely recommendations, 2 of them actually, pertain to selecting the best body CT protocol and limiting use of the protocols with higher radiation and higher cost. And so radiologists do have a really important role, from selecting the right patient to selecting the right protocol.
Good. Well, good luck in your future endeavors, and thank you for being with us today.
Thank you.
Signing off for AntMini.com, my name is Brian Casey.